You had a baby, and now your hair is falling out.
Everybody's hair falls off.
I mean, my hair is falling off. I don't have a baby either.
No, but after baby, everybody's hair falls off. It tricks women because it falls off 4 months after you had the baby. So
Stressful.
That's the tricky part. So.
Well, if anyone would know, Dr. Heidi Goodarzi does. She is not only a dermatologist who is an expert in hair loss, but a pediatric dermatologist.
But also had 3 kids and had hair loss. That's the important part. I mean, nothing like experiencing it yourself and being like, wait a minute, I've been talking about this thing, but now it's happening to me.
Well, super stressful, and you're someone who helps patients navigate that journey, and you understand the science behind it.
Kind of.
I want to know, kind of. Well, if anyone does, well, at least you're not swindled by the Dunning-Kruger effect, okay? Okay, no Dunning-Kruger in this office.
No.
Can you explain to me and everyone else what exactly is postpartum hair loss and what causes all of this hair to fall out 4 months after you have a baby?
There are multiple causes of hair loss after having a baby, but the most common one that people associate with pregnancy is telogen effluvium, and that could happen after any stressful event. That could happen after childbirth, that could happen after a car accident, ICU stay, just any physiologic stress to your body, and also after emotional stress.
Me!
Yeah, so after COVID, we saw a lot of telogen effluvium, even though we think it's intense one-time stress on the body, but apparently we learned that long-term stress can cause it too. So basically, at any time, about 10% of our hair is in the falling stage. And then because of that stress, you just have a higher percentage in the falling stage, so you lose a lot of hair. And people see that and get really stressed out. But the good news is that if it is telogen effluvium, it's reversible. It comes back. It doesn't scar your scalp. It grows back. Reassurance, reassurance, reassurance is the name of the game. Where it gets dangerous or where it gets tricky is where other causes of hair loss is just called telogen effluvium, no worries, go about your day, and then it wasn't telogen effluvium. So that's why it's important to get evaluated, because there are other causes of hair loss that could happen at the same time. With childbirth, a lot of times mothers lose a lot of blood. So you can have anemia, you can have iron deficiency. Sometimes pregnancy or hormonal changes can contribute to the hair loss indirectly associated with hair. Like those hormonal changes can put you into a thyroid disease that is new onset, or autoimmune thyroid disease that could cause hair loss, and then you don't want that to go undiagnosed. And then other inside chemistries, other metabolic things that could happen. So that's why we like it if patients can to get evaluated to make sure it is telogen effluvium. But if you have a diagnosis of telogen effluvium, then rest assured that it will come back 90-something% of the time. It will come back depending on the study you look at. There are very, very few people that kind of have it permanently, but it will come back, and in reality, you don't really have to do anything.
Amazing. So your hair is falling out 4 months after you have this baby, or you went through a stressful event. If it's just telogen effluvium, no issue. Now, what if it is one of those other things? If it's blood loss due to, traumatic birth and therefore anemia, what do you do as a dermatologist or a doctor in that case?
Yeah, so if there is a risk factor, we order blood work. So we have a whole iron panel studies that checks your iron level, your ferritin level, your iron binding capacity, all these fancy labs. And then according to what we see, then we can treat it with supplements.
Amazing. And a lot of those supplements that are taken orally are fantastic. Make sure that you're getting them approved and prescribed by your doctor, your dermatologist. But did you know that even caffeine can prevent certain minerals like iron from being absorbed? So you also have to keep in mind what you're combining those foods with, which is why you talk to experts to make sure that you're not wasting your money on supplements and guzzling 5 gallons of coffee a day.
Absolutely. And also, please don't take supplements without talking to a healthcare provider, talking to a physician, because there are a lot of side effects to taking these supplements without supervision and unnecessarily, But if the vitamins are down, if vitamin D is down, if iron is down, if some people have shown that zinc deficiency could cause telogen effluvium, you just want to get evaluated. But there is no oversight on supplements, so you want to make sure you get it from the right source. I usually recommend beYoutiful, or one developed by one of our dermatologist colleagues named Inner Glo. I've taken Inner Glo, my family and my patients are very happy.
What does this have in it that is so helpful for skin, for hair?
Yeah, read the back of it and tell us what it has.
Learn and learn.
The results I've seen with it is amazing, but it's 3 humongous pills you have to swallow every day. So I usually tell patients, have the intention of taking it as directed, but take anything you can. I'm a very understanding of the challenges of skincare, hair care. Life is not perfect. I put it on my counter, and a lot of days I look at this beauty and I say, you know what? Today's not a day I can swallow you. I'll stay right there. Maybe
just
tomorrow.
drink my coffee instead.
Yes,
Yeah.
maybe. Or sometimes I hold my nose, and a lot of them because they have the fish oil or the.
Not for me,
the
the veggie lady. Those look
They
like
are
horse
huge.
pills. Oh, they smell. Sorry.
So I love that it was developed by a dermatologist. If you go to our website, a lot of dermatologists have used it and talk about it. Obviously, it wouldn't work for you because it has very pure, very potent fish collagen, and I think that is actually one of their secret ingredients, and that makes
Really?
it smell really bad.
Tell me about fish collagen, because collagen is a blend of 3 amino acids. Okay, sorry.
She knows all this stuff.
Seen results.
Nobody
That's what
teaches
we're-
you anything about skincare in dermatology residency or anything. Unhinged, Dr. Heidi, unhinged.
Dr. Heidi Unhinged. But if people get their blood work done, they're lacking in something, they're low in something, that's when you would supplement either with a medically prescribed option or over the counter.
This is just a supplement that is good for anyone.
Healthy hair, nails.
Even teenagers with like thin hair,
Oh.
we've recommended too at times.
Fabulous.
Yes, this is for anyone.
Okay.
If there is a deficiency, then we prescribe that vitamin. You can
Perfect.
get prescription iron supplements, you can get prescription vitamin
Ergo
D supplements,
calciferol.
and there are ways to bring the vitamin D back to normal. There are protocols for it, so it's not like just go randomly get a vitamin D and take it.
Well, that's the next question. Let's say that someone just had a baby and their vitamin D levels are low. Maybe there's a little bit of a hormonal imbalance. Maybe they're just not getting enough, vitamin D synthesis in their diet through mushrooms, through oysters, or through the sun.
Or maybe our vitamin D testing is just off because everybody is low
Everyone's
these
deficient.
days. Yeah,
Yeah.
I don't know what is up to that because we live in California and it takes 10 minutes of sunlight to produce enough vitamin D.
And you're in
for
Southern
skin.
California.
Yeah.
She's in Newport Beach. Come say hi. She's taking
Newport Beach,
patients.
sunny all the time. And most of our food is fortified, so I don't understand the epidemic of vitamin D deficiency. But
Doesn't
if
make
it's
sense.
low, then I would recommend that talk to a physician about what protocol to use to bring it to normal level. Vitamin D is extremely important in skin health, in hair health, in energy level. People who are extremely low vitamin D level sometimes get misdiagnosed with severe depression. Because it gives the same symptoms. You're too tired, you can't get out of bed, you don't have energy to do anything, you don't have motivation. So it's really important to treat vitamin D deficiency.
Especially if you have postpartum hair loss and postpartum depression, make sure that you're speaking with doctors and with experts about looking at blood panels, looking at everything to make sure that you're as healthy as can be, and so is your baby. Let's
A
say
plug for postpartum depression. I think a
Yeah.
lot of that goes undiagnosed too. Any psychological stress can make any skin or hair or nail condition worse. So that's actually something to take into
stress can cause telogen effluvium. So let's say that someone had a baby, they don't have telogen effluvium, they're not iron or vitamin D deficient, but their hair is still falling out. And you look at their thyroid and there's some thyroid concerns. What would you then do?
I would refer them to an endocrinologist who
Love
is
that.
expert in hormones. Just know people have very specific expertise in our modern way of practicing medicine. So I would just say, hey, my job is to test and make sure your hair loss isn't due to thyroid. So then I'll send them to an endocrinologist. Sometimes we even do biopsies. I have had teenagers as young as 16, 17 that thought they have telogen effluvium, then they thought they have just androgenic alopecia just due to like people in the family have genetic predisposition to losing hair, and then we did a biopsy and we found a scarring form of alopecia that we have to treat with very heavy hardcore medicine. And one particular teenager, I remember, mom has hair loss and has had hair loss for a long time, and the day we were going to do the biopsy, because for hair loss you need 2 biopsies, she kept insisting that, why are we doing this, we already know I have hair loss, she has hair loss, why are we putting this through? And obviously I said, if you don't want to do it, we'll stop, no problem. But that's the one child that has very serious scarring alopecia, and the fact that we started her on treatment could potentially save her from losing all of the hair. And unlike telogen effluvium, in other types of hair loss, you can have scarring alopecia. You can have the hair follicle be gone forever and be left with scar. So there is no treatment for that other than hair transplant or wearing a wig.
And let's talk about the difference between telogen effluvium and androgenetic alopecia. Because if a young mom is like, oh my gosh, all these big words, this doesn't make sense. Let's break down that word. Telogen is a stage of the basically hair cycle where the hair is falling out. You can think of it as ACT because your hair is acting with you every day. And it's normal to lose about 80 hairs a day. But
Even
telogen,
more, I would say.
Even
100,
more?
yeah.
Is that why it looks like there's a dead rodent in the bottom of my shower every day?
Everybody says that, and I say, well, up to 100 hairs is normal, so unless you count them and there were more, but you're you're supposed to see hair in the shower. Yeah.
It's normal.
Yeah.
But when you look up close, which a doctor or a dermatologist can do, you can actually see how many hairs are growing out of each follicle. Or if some of those follicles have 0 hairs falling out. And if it is telogen effluvium, where it's effluviuming, it's basically coming off the scalp. That is...
I love that word.
Effluviuming.
It's effluviuming out of your scalp now.
Right? But that's very different than looking at the scalp and saying, oh my gosh, there's actually a scar here and no hair can grow back. Or where there's maybe 2, maybe 3 hairs that should be coming out of that follicle, there's 0. Can you explain what androgenetic alopecia is and when that might be happening to a mom who just gave birth versus just the regular telogen effluvium?
Yeah. So we all know that male lose hair with age, and we all know that it's genetically predisposed. So if you had a dad, if you had an uncle that lost hair, then the chances are you would lose hair. Some men start losing hair as early as their 20s or 30s, some a lot later in life. The same concept exists in women. So because it's due to the male hormone, you usually see it after the female hormones have gone down after menopause, and then you see hair loss in women. But there are some women who have a strong genetic background, like an uncle or an aunt or a mother had hair loss, and they see this pattern alopecia way earlier. The only thing is that it looks different than males. So in males, you lose hair in the front and on the top of the scalp. In females, we see it in terms of thinning all around.
Like a Christmas tree.
Yeah, so a lot of people in their 20s start, and it could coincide with the stress of childbirth or with that age, but you want to kind of differentiate those two.
Amazing. And if someone does have androgenetic alopecia, how do you diagnose that in clinic?
So with alopecia
what do you look
areata,
for? Yeah, so
we
what
look
do you
for
look
the
for?
pattern. There are called diagnoses of exclusion, meaning that you have to have ruled out all the other ones. You can't have a patient, even with a dermatologist, you can't have a patient and say, hey, you have female pattern alopecia, have a good day. I have to make sure there's no thyroid disease, there's no hormonal issue, there's no scarring alopecia. So that's the kind of the algorithm that we go through. I rarely, sometimes it's very obvious because of a clinical training, but I rarely tell someone, hello, you have this pattern alopecia. I'm sorry, it started when you're 30. Have a good day. Take some Nutrafol and come back. We usually do blood work. I'm a very blood work friendly doctor for acne and for hair loss and for autoimmune disease, because I think a lot of things go unnoticed. Unrelated, but I want to tell you this story. I had a teenager with hair loss, and they were all concerned about why is her hair falling off. And I seen this kid over the years here and there, and I looked at her and I said, you look very thin. And I asked the parents, and they're like, well, eats less, but not that much. And it turns out that she lost like 20 pounds of weight. So the main cause of this hair loss that they were pursuing for a couple of years was anorexia and nutritional deficiencies. So she was actually admitted to an inpatient program. She switched school, and the hair loss came back. So you have to look a little bit deeper sometimes. Please don't mistake that with what is the root cause of this. The root cause of it does not exist in Whole Foods. That's all I can tell you. Sometimes you have to look deeper and find, other reasons, and you can't just rule them out. And your dermatologist will know that. They would look for other things. They would order labs. Listen, skin disease, hair disease, nail disease, it's still a disease. Taking a vitamin for hair loss, it's a good idea. But if you have a hair disease, you have to get the right diagnosis and the right treatment. So they complement each other. They don't replace each other.
That makes sense.
Thank you for coming for my TED Talk.
Yeah, no, thank you for bringing me to your TED Talk. Let's say that someone is struggling with hair loss. They want to stimulate hair growth, and they want to come to you in clinic. What options do dermatologists and doctors have when it comes to stimulating hair growth? What options do derms have that the regular people can't touch, but if you want to come into a pro, can be offered?
I think PRP and laser are the two big ones. Currently, we only have PRP. I don't have a laser. Hair restoration in this clinic. I have to tell you that hair transplant has made huge advances. I don't think many people know about it or utilize it. Even for eyebrows, I've seen some beautiful hair transplant eyebrows in the right hands. It's not the old school thing for only men. It's come a long way. So at the end of the day, if we have a scarring alopecia, even if you've lost the hair and you have scarring alopecia, you have hair transplant. But there are some really good at-home devices too that some of the dermatologists been involved in development or trying them out, and there's some really good ones out on the market.
Explain what happens in a hair transplant, because you're basically taking hairs from somewhere that aren't as widely seen and literally transplanting them somewhere new. And then you get them to grow. You give them growth factors. You make sure that someone's nutrition is good. But you're basically taking hair.
I know as much as she does.
Well, yeah, you do.
Hair transplant.
She can give you recommendations for a hair transplant
Yes,
person. But
yes,
PRP, laser, and hair transplants are the big professional ones. You go in for clinic. You go into treatment. If someone's struggling and they want options at home, what sort of things do you recommend, or what's available?
There are some really good devices. So we all know that light, just visible light, like LED light, red light, we know could have anti-inflammatory effect and could increase blood circulation. On that note, even gently massaging the scalp, you know, that's why it feels so good when you're at the salon and they do it, or just like brushing it on a regular basis. Massaging would increase blood flow. We like that. Not too harsh, but a gentle massage. So light could increase blood flow. That's really good for the hair. Light could be anti-inflammatory. That's really good. Then lasers that could be incorporated in this at-home devices, and they kind of stimulate the hair follicle. So low-grade lasers stimulate hair growth, and you may have heard that if you go for laser hair removal and they don't get the right setting on you, right? Say you had a little bit of hair and you went for laser hair removal, but the person wasn't like well trained and they just kind of did a low setting, you start growing a beard. Yes, it stimulates, it gives the hair a little warm fuzzy boost, and then it grows. So we see especially people of color, because then the laser technician gets scared of burns and brings the settings low, and then you come and you have extra hair growing because they just gave a little fuzzy boost to the hair, and the hair loves it and grows more. So that's the whole concept of like at-home lasers, and I think that's actually a really, really good option because access to other treatments is not as much, and also they're usually invasive. Like PRP is painful, and then you have to do it's a lot of needles into the scalp. And especially like males do not like that. Females are a little bit more used to inflicting pain for beauty, but it's a painful procedure. There's a lot of injections into the scalp. So at-home treatments could also be really good. The other things are at-home products that I think we didn't talk about. Like we love minoxidil. I think there's this Rogaine, minoxidil, 5% Rogaine foam is readily available. It's cheap. It's very effective. I love it. I love it for everyone, males and females. They should all use 5%. And there's this misunderstanding that if you use minoxidil, then when you stop, your hair kind of drops. That's not the case. Think of it as like fertilizer for your hair. So it keeps your hair strong and thick. And once you stop, you'll go where you were supposed to be without the minoxidil. Yes. So if your trajectory of hair is like this and you artificially with minoxidil kept it here, then yes, it goes back to without fertilizer, it would be here. But it doesn't have an adverse effect on dropping the minoxidil. As of a few years ago, we use minoxidil oral too, so you can ask about your dermatologist. That works for a lot of different hair losses too, and it's really good medicine because it's actually blood pressure medicine. So if it doesn't drop your blood pressure, then it doesn't really have that side effect. Finasteride we use, it's a blocker of male hormones. It used to be a medication used for prostate hypertrophy or enlarged prostates, but in low doses we can use it to block the male hormone. It's good for males, it's good for females that are not of childbearing age, but we have other options now that we could use too. Another medicine that is really good is phenolacton that also kind of causes with the hormonal causes of hair loss. So talk to your doctor. There's a lot of different options.
Spironolactone is also great for acne, hormonal acne, and if you pee. And you think about hormonal acne because of that imbalance of male and female hormones.
Very
Same
good
thing
point.
with the hair. Yeah, it's all
so
connected.
It helps both. You know, if you have hormonal acne and hormonal hair loss, those people really benefit from
What if you're just hormonal and emotional all the time?
Then you just come and get
Hugs! They fix everything.
Hugs fix everything.
No, but specifically for at home, I've been using this guy.
I like this. Where did you get this one?
Well, you have to plug it in. You can get it online, you can get it on Amazon, but this basically is the elite one. It has 500.
This is the one that has LED and laser.
It does.
This is good. I need one for my husband. I Restore, what is it called? I Restore. If you're watching this video, which I'm sure you are because I'm very famous, I need one for my husband. Thank you
We
very
will
much.
get you one for your husband. But no, this is something that another dermatologist, Dr. Dre, actually influenced me to buy. I purchased the regular one and then got the elite one, but I can wear it while I'm doing other things. And
Not everything. Like
Not
there are
everything.
situations that you should not be wearing this.
oh
So
yeah,
if
I
you're
can't do
doing other
jumping
things-
jacks or if I'm sitting in the bathtub.
Or if
like,
people
no.
are looking at you. Or but on a motorcycle, it would work really well.
No,
the
you have
helmet
to wear,
doubles as a
no,
helmet.
You have to wear regular motorcycle.
Yeah,
we
that's
have
true.
road safety, ma'am. The DOT tested helmets, always, please.
There you go. Okay.
No, but this is something that I found benefit with, and a lot of people who, you
It
know,
matches my Peloton. I think you should wear it when you're doing the Peloton. That would be the ultimate health effect. You restore your hair and you do your Peloton. That's awesome.
no, but this is something, it has 500 diodes for LED light and for low-level laser, and it helps essentially stimulate circulation,
Yes.
lower inflammation, and help with hair growth. This is something I've been using as a derm.
Dermatologist approved, 100%.
Really?
100%.
Do you approve that I use this?
100%.
Do you approve of my aesthetics?
Has it helped you?
I think so. And then I got stressed and then I
Yes.
started using it again.
There's
and then,
no downside to it. I think it's great. If you can
the
afford
price.
it, get it.
That's
use
the
it,
big
yes.
downside. Yeah.
But it's a technology. It's not easy to bring lasers home. You know, at-home lasers are a new thing. It's a technology, so it is expensive. Yeah.
Yeah. And as you said, there's also medications that a doctor can prescribe.
Mm-hmm.
You don't have to use things at home. You don't have to do things in clinic. The best is knowing exactly what's right for you, getting that tested,
Yep.
getting those results, and then doing what your doctor says along with what might help at home. Let's say that someone just wants to look and feel pretty. Do you have any favorite hair care products or anything that I should use?
No, I have something I should use. I use on a regular basis.
do
'cause
tell.
I got gray hair since I was 20. So when all else...
Do you really?
Yeah. Wigs, hair extensions, powders. My hairdresser turned me onto this one because it's wow.
Wow.
I get gray hair very fast, and because I take my hair vitamins, I think my hair grows really fast, so I have to go very frequently. I'm talking about like in 10 days I have to go back and color my roots. So I use this to camouflage the grays, and you know, it's all about feeling good and feeling great. So if I can cover it, I feel good, I'll do it. So camouflage.
If you want Dr. Heidi to talk about what causes gray hair and what to do about it, subscribe, hit the like button, follow her, and let us know in the comments. Otherwise, she'll shut her big mouth, or she'll just keep talking about other things
I
other than
just
what we
said I
want.
have gray hair, so don't listen to her. If I knew what to do about it, I wouldn't have gray
Well,
hair.
you're
So
lying.
that's
You gotta be lying.
no, mine is very gray.
So sometimes after childbirth, moms have hair loss, but even kids can get hair loss too, right? If you want a separate video on alopecia areata for kids, again, pediatric derm, she's an
Great
expert.
subject.
Go to her channel because that's where you're gonna find it.
Devastating for kids, devastating for parents. We have magical treatments. Yes, follow me.
Yes, follow her. I'll make sure that everything's listed right here. And Dr. Heidi, at the end of the day, you know, a new mom is having a baby. Maybe they haven't seen a derm yet. They're a little bit overwhelmed.
Just get through the first year, it gets better. That's my recommendation to every
As a
postpartum.
mom, yeah, what is
Honestly,
it?
just get through the first year, it'll get better. It's the most overwhelming thing you've ever experienced. I always say internship and medical residency was much easier than having a baby. So be gentle with yourself, be kind to yourself. This body just grew a human being. Just enjoy that and know that a lot of those changes in body are reversible and you have time to deal with them. So take your time, be kind to yourself, sleep.
You just brought a
Take care
human
of
into the
yourself.
world.
Exactly, and everybody's like, how's the baby? No, ask how is the mom? How am I doing? What is happening here? So yeah, babies are cute. We're not as cute as newborns, but the moms deserve all the attention and all the care. The more you take care of yourself, the healthier your skin and hair would be. And I mean that. If you're sleeping better, if you're exercising, if you're walking, if you have less stress, if you're not panicking over every little thing your baby does, then you'll have better health, including your hair health. So I say that from experience because the first child particularly, it's a mess.
Well, you heard it straight from Dr.
Yes.
Heidi. Again, all of the details are below if you want to come see her as a patient, if you want to subscribe to her YouTube channel and learn about when children have hair loss, there it is.
Also, I want to put a plug for Cassandra. She has so much skincare knowledge that I learned so much from her.
Do you really?
So I really do, and I really mean that. It's rare that a skin influencer is this educated, is this science-based, used to be an esthetician. I love everything she says, and
Tell me
everything is...
Where are my grapes? I need to lay on like a Greek. You know, feed me grapes and wine.
Come to
Anyways.
Geneva, Newport Beach and visit us. Come to Children's Dermatology in Orange if your child has hair loss.
And stay hydrated, reapply your sunscreen, And we'll see you on the
Just
internet.
don't be dehydrated.
Don't be dehydrated.
Don't stay hydrated.
Don't stay hydrated.
No, if you're dehydrated, it's bad. But if you keep drinking water, you just pee more.
Well, or if you're on spironolactone, you just pee more.
Yeah, so just don't be dehydrated, but don't keep saying that
Okay,
you have
so
to have
don't
like
be
5
dehydrated.
gallons of water because somebody told me your body is very you have kidneys.
You have kidneys and a liver.
They
I
will
only have one
regulate.
kidney. I have one.
You drink more water.